o'clock, and we want to welcome everyone to the May Sleep Well and Respiratory Health webinar brought to you by Health Products for You and shopnebulizer.com. We're glad that you could join us either for the live webinar or if you're joining us here on YouTube and watching the recorded session. My name is Justin Paiva, and I'm happy to be joined by Laura Castricone. She's our staff respiratory therapist. Welcome, Laura. How's the day going?
Day's going great. Thanks, Justin, for having me.
Good, good. So when you brought up the theme for today's webinar, it was really intriguing, chasing the dragon.
Yeah, there has many terminologies, obviously, some not so much, but basically what the terminology is supposed to meant to mean in the sleep world is constantly trying to get that good night's sleep that you had when you were a kid, that you could never kind of recapture. Like you remember when you were a child and you fell asleep in the car and somehow the next morning you woke up and you were in your bedroom. You don't even remember how that happened. Yeah. So that terminology was meant to be something that we're constantly trying to find as we get to be adults. We have a harder time maintaining sleep. So today we're going to talk a little bit about sleep hygiene.
Yeah, what an interesting topic. Let's get right into it. Lots of questions that we fielded in advance. And so what exactly is sleep hygiene? You bring up that topic. Why is it important?
Well, as you know, I'm a respiratory therapist, and we talk about hygiene for everything, lung hygiene, teeth hygiene. So there's also hygiene for your sleep. And what that actually means is it's the science and the practice of maintaining and restoring your sleep health. Sleep is a very important process, although we don't understand it fully. We do know it's a restorative process, and if you're not getting a good night's sleep, it can cause a lot of havoc in your system. It can cause a lot of chemistry problems in your system, and it's of the utmost importance now because we're a 24-hour society, especially in the United States. We're working round the clock, and we tend to forget that we have to make time. A third of our life is supposed to be spent sleeping, and our sleep time is getting shorter and shorter in this country because we're working more and we have a lot more commitments to family and work as well. So sleep hygiene is actually trying to teach people on how to treat their bedroom, their environment, what physical things and mental things to be aware of in order to get a good night's sleep.
Yeah, when you brought that up, it was just such an interesting combination of thinking about sleep, because we think of that in its own thing, and then hygiene is being something separate, right?
Right, we take sleep for granted. We just think, okay, I'll go to sleep, but we don't understand that we actually have to have a restorative sleep. It's not just a process of going to bed and laying there for 10 hours or 8 hours. It's what kind of the quality of sleep that you do get when you are in bed.
And one of the things I've learned from you in these webinar sessions, and of course our time together working in the office, is how important sleep is and how connected it is to our overall health. So it's such an important topic. So what are some of the things that we can do to our sleep environment to help us to sleep better?
Well, this is very important now because since the pandemic, a lot of people are working from home. And I realize that a lot of people have very limited space. So where they're going to set up their computer and where they're going to go do their work is not arbitrary. Sometimes they only have one choice, the bedroom. However, in sleep medicine, we're taught that the bedroom is to be used for the 3 S's: sleep, sickness, and sex. And of course, we're talking about adult sleep. And we're supposed to, when we walk over that threshold to our bedroom, we're supposed to feel that sense of peace and serenity, that this is a place where we're going to go to sleep. Unfortunately, in this day and age, we treat our bedroom like every other room in the house. The kids play in there, we eat in there, we write our bills out in there, we watch television in there, we do our work in there. So the room that's supposed to be a restorative place to go and rest in and get some sleep is now a playroom. It's a kitchen, it's a dining room, it's an office, it's everything but what it's supposed to be is a bedroom. And I remember growing up, and we were never allowed to go in my parents' bedroom and play in there or jump on the bed or any of that type of stuff. It was their sanctuary, and we had our own rooms to go to. But like I said, in today's society where we're home a lot now and our children are home too, we really have to try to privatize our area where we go to be private, to sleep, to be intimate with our partner, or if we're ill and we just need to go and take a rest, or when you want to have some downtime. So the environment that you sleep in is very important. And the things that are important in your environment are 3 main things. And besides treating your bedroom properly, you have to have the right temperature in your bedroom. As we all know, as we're getting into the summer months, If it's too hot in the room, you won't be able to sleep. And obviously if it's too cold, you can't sleep either. The body likes the room to be around 60 degrees, believe it or not. It would even like it to be about 58. Some people think that's very cold, but people sleep best when it's colder than when it's hot. Light intrusion is very important as well. And that brings up the fact that we have computers, iPads, and telephones, which use a lot of blue light, which simulates daytime, which causes the brain to want to stay awake. Also, our environments are, especially now, we're always diligent waiting for that text or that notification to go off on the phone. So that's a sleep disturber as well. We try to tell everybody to get all the electronics out of the bedroom, especially if you have children. Getting out of their room is of the utmost importance because children are even more affected by that and they need more sleep than we do. A lot of people don't know as an adult you need at least 7 to 8 hours of sleep. Most of us only get maybe 5, 6 if we're lucky, but 7 to 8 hours is the proper amount of sleep that we should be getting. And the other factor in your environment you have to be aware of is noise. So it's temperature, light, and noise are the 3 main factors that you have to be aware of that are huge sleep disturbers. You obviously know that the lights are on, and we try to encourage kids to sleep with the lights off. I know a lot of children are afraid of the dark, but if you can use something that is low lit, with a big shade, so that way it's not, right in their face, because that's going to keep them up. Ultimately, it causes their brain to release melatonin, it causes the brain to stop release melatonin, so that way they don't sleep as well. So your environment is very important. So don't treat your bedroom like another room in the house. Try to keep the temperature regulated. Also, environmental factors such as your bed. Is your bed comfortable? Is it sagging? Is it killing your back? You can't sleep properly if you're constantly tossing and turning because you're on an uncomfortable bed. So you should always buy a bed that supports your weight. Also, what you wear to bed at night too. You should wear breathable cotton or lightweight, something lightweight, or nothing if that's how you're comfortable. But wearing a lot of synthetics a lot of times causes you to perspire, which will obviously wake you up in the middle of the night. So there's a lot of little weird things that people don't even realize can be sleep disturbers. And of course, women, as we age, and go through our change of life and menopause, our sleep changes completely, and we are naturally warmer. So that's when bedding becomes, and clothing in bed becomes very, very important, so that way you can sleep properly and not be overheated or freezing.
It's so interesting because there's just so many things that can actually disturb our sleep, disrupt us, and throw us off into a bad pattern. So,
oh, absolutely.
Yeah. All right.
I think a lot of us are already in those bad patterns. We didn't even realize it.
Yeah. I mean, the blue light in the room is constant, it feels like. Okay, so those are some of the things that we should do. Are there things that we should really avoid to maintain good sleep hygiene?
So I'm going to tell you a few things that you probably should avoid. Even though I like to have a drink before bed, that's not optimal. Alcohol before bedtime has a couple of detrimental effects. Yes, initially a nice glass of wine will help relax your muscles and you might fall asleep more quickly, but it actually has a short duration and it'll wake you up at some point shortly after. Also, we know that drinking extra alcohol makes you have to get up frequently to urinate. So that's another sleep disturber. So if you're constantly getting up to go to the bathroom, that's not really helped you. So avoiding alcohol between 4 and 6 hours before bedtime is usually optimal. Exercise. We want everybody to exercise and stay healthy and be fit and feel well, but don't exercise right before bedtime, because obviously exercising before bedtime get your body juiced up and ready to go. And now you want to relax. You're not ready to go out and face the day. Your exercise should be done again within 4 to 6 hours before bedtime. And another big thing is eating heavy meals. You don't want to come home from work, eat a big meal and then try to go to bed with that. Especially if you have reflux. We know that reflux is a huge sleep disturber for a lot of people, and it can cause some health problems as well. And that's when your stomach contents come up or the acid from your stomach comes up into your esophagus. And a constant effect of that can cause some damage to your esophagus. So eating heavy at night is not optimal either. And be careful what you eat at night. Spicy foods, things that give you heartburn. And if you do normally get heartburn, or if you honor any acid neutralizers, we do recommend that you take those before bed, so that way you don't get reflux and you can stay asleep and not have the stomach contents coming up. So basically, within 4 to 6 hours before your bedtime, no drinking of alcohol. You shouldn't be exercising heavily. You shouldn't be eating heavily. And the other thing is you shouldn't be having caffeinated beverages and cigarettes. People don't think of cigarettes as a sleep disturber, but they have nicotine, and nicotine is a stimulant. So if you're having trouble falling asleep and you're a heavy smoker, you might want to have your cigarettes way before bedtime and not to smoke in the middle of the night or right before bedtime. Also, caffeine, drinking coffee or caffeinated beverages before bedtime is another sleep disturber. That's going to cause you not to be able to fall asleep, and it's going to be a longer duration. And so you should do your caffeine again. 4 to 6 hours is usually the magic number before you go to bed to avoid these things.
Yeah, that's very informative because, you know, it might be that our schedule is that we feel like we need to eat dinner late and our time is compressed, but we're actually harming our sleep. We're filling our belly, but we're hurting our sleep. So
right, well, you have to compromise somewhere. You can't have everything the way you want it, unfortunately.
Yeah,
so
that a good rule of thumb though, 4 to 6 hours, like you said.
to avoid those things, approximately 4 to 6 hours before bedtime. I know that there's instances where you just can't do that, but you may notice that on those nights you're having a poorer time sleeping, or you're up and down more frequently. And we're trying
and again, we're concerned because we're sleep deprived, and it has this impact across all of our health. So
sleep deprivation can cause a lot of problems as your body goes into a stress. Your body doesn't know what's going on. It's just stressed because you're not getting enough sleep, and you can release a lot of different chemicals in your body that can cause harm to a lot of your body systems. So it's not optimal to be sleep deprived. It really, really isn't. And some of the things that you can try to do mentally, that's another thing too, we're all guilty of that. We go to bed and we have a lot of things on our mind, finances, family issues, everything. That's the hardest thing to get rid of. I have to tell you, the not exercising and drinking alcohol or doing your bedroom over is usually the easy part. The hardest part is the mental, or what I call the stinking thinking, that you start doing before you go to bed. You're thinking about, how am I going to pay that bill? Or how you have to really try to set some time aside during the evening or in the morning or sometime during your day to think about those things and make it, even if you write it in a journal, to attack it the next day. Remember, going to bed with those on your mind, you're not going to be able to solve those problems while you're sleeping. But you might feel better if you had a good night's sleep and be able to tackle those problems the next morning, or those issues that you've been thinking about. But ruminating over them all night is going to keep you from falling asleep. So mental disturbances are and of course, there's certain medications, but that's something sometimes we can't avoid. Some medications will keep you awake, in which case that's when you should have a conversation with your physician and let them know, I'm taking steroids, but I can't get a good night's sleep because they're keeping me awake, and the doctor will try to find a solution for that.
Yeah, great. I mean, anything that we can do to kind of protect our sleep health. And,
we need to
keep getting better there. So great suggestions, Laura. Now, many of those that are joining us, they're looking for different forms of content, and maybe they've tried some of these things, or they're learning about these things, and now they're going to go about applying them. But what happens if we apply all these suggestions? We get rid of the things that we're supposed to. We change our room and we change our behaviors, our routines, and it's still not working. What should we do?
If you're still not getting a good night's sleep, you have to have a discussion with your medical provider. Whether you have a doctor or a APRN, whoever it is that takes care of you, I would start with your internal med doc and just say, I'm having a hard time falling asleep at night, having a hard time maintaining my sleep. The pivotal thing they're going to ask you is, do you have a sleep partner? And if you do, they're going to ask you, does your sleep partner report that you snore or stop breathing during the night? That is a huge issue. If that is going on, that could mean that you have sleep apnea, and that needs to be addressed. So just not getting a good night's sleep is a little bit different than having an actual sleep issue. So, but if you're still not getting a good night's sleep, you will end up with a sleep issue over time. So you do want to have a discussion with your primary, and he or she may send you to a doctor that does nothing but sleep medicine. There are sleep laboratories. There are docs that are board certified in just sleep medicine. They know the latest and the greatest medications to take for insomnia. We even have a doc, he's in Great Barrington, Mass, that does biofeedback for patients that can't sleep. So there's a lot of things out there, and new things come up every year, probably every couple of months, on better ways to attack these problems that people are having. So have a discussion with your physician. Don't let it keep going and think that it's normal, because it's not normal to get no sleep at night or a very limited amount of sleep. Eventually it's going to catch up with you. We call that sleep debt, and you're going to have to pay that debt somewhere along the line, whether it be health-wise or not being able to do anything because you're just so, you're exhausted. So it'll come and get you somewhere.
And I know that's where a lot of your experience has been, is helping patients for many years in the sleep apnea
Yes.
and how to navigate, the use of CPAP machines and masks and getting everything fitted and
Yep, and it's not as scary as people think it is. It works like a charm. I set up thousands, literally thousands. I've been a respiratory therapist for almost 30 years. I've set thousands of people up on CPAP. And I always say, if I had a nickel for every patient who told me I didn't believe in it, I wasn't going to do it, but I persevered, and how much better they felt afterwards, even though they weren't enamored with the therapy, they felt better. And that pushed them to continue on with it. It really works. It's just getting over the hump of using it, or some of the things that you get tripped up on as you're using it. And that's why we're here to help you with those things.
Yeah. And yeah, beautiful resource to have content available by way of healthproductsforyou.com, shopnebulizer.com. Laura, you're providing us great content that is directly related to what you've seen from patients for years and years. So we're super appreciative of that. Okay, well, great information today, Laura. We really appreciate it. Let's see, the Q&A session is open, so if there's anyone that has any questions that are our attendees today, please feel free to use that forum. I don't see any open questions quite yet. We'll give it a minute. Yeah, no questions yet, Laura. You're nailing the information. So.
Well, they can always email me.
Yep.
And ask questions if they feel they don't want to ask during this format. I'm Laura at HPFY.com. You can feel free to ask me any question. I've probably heard it, seen it, done it, as far as when it comes to sleep medicine or oxygen therapy. There's a lot out there. There's new things coming up in the sleep arena that we'll try to keep you up to speed on as we learn them. Otherwise, I hope if you do have some questions, you do reach out to us so we can help you, especially if you're a CPAP user and you're struggling. That's one of my areas of expertise. I'd love to be able to help you with that. So
actually, we do have a question, it looks like here. I'm just gonna.
Awesome.
Okay.
Oh, there you
Hello,
go.
can you hear me?
Yeah, we can hear you.
Yeah, go ahead, Eric.
Excellent. Okay, I do have a sleep problem, which I've had for quite a while.
What is that?
I was on temazepam long term because I worked night shift. So working night shift, and then I'd have to flip flop the days.
Yeah.
I did go about 3 years on 3 hours a night sleep.
Yeah.
That did some damage. Next thing you know, I got sleep apnea.
Yeah.
I did get tested 16 years ago.
Okay.
And I couldn't sleep with the machine on, and they tried. That's when I first used temazepam, but they tried Ambien, they tried everything. Nothing would work, so I gave up the machine. Second try, 16 years later, I've been successful for 2 years.
How you feeling?
Better with the machine. But yeah, I run about 1 to 5 apneas on the machine, on the Philips machine, which is nothing.
There's nothing. We don't even count those, right?
Yeah, it's normal. There's no effect on it. But I did go years on deprived sleep. Some people told me I may have killed brain cells.
Yes. We know now that untreated sleep apnea can cause dementia. And that's usually because of the lack of oxygen to the brain, because every time you don't breathe, Eric, your airway closes off, the oxygen level drops. And, over the course of many years of not treating it, doesn't happen instantly, obviously. It's the course of many years of not treating it. And you're not alone. A lot of people try CPAP therapy. It's not for everybody. And you're very common. I hear that, I'm revisiting it many years later. And to tell you the truth, there's better things out now. So I wouldn't doubt that you're more successful. When I first started with setting patients up on CPAP, they weighed 16 pounds and they weren't travel worthy, and they were loud, and your bed partner had to sleep in another room, and it was terrible. So we've come a long way. So I'm glad to revisit it, and I'm glad that you're
things are good right now, but I did have a problem at first, which I had some events going on. My blood pressure went uncontrolled. It went up to like 190 over 120. Doctor put me on 3 meds. Then a friend of mine who uses the same thing as I do, the nasal pillows. He told me his chin strap irritates his skin.
Right.
And I said, chin strap. I go, I don't wear one. I go, wait a minute. I'm told that due to my many allergies, I sleep with my mouth open.
Yeah.
So I was breaking the circuit. All of a sudden, I used the chin strap.
Miracle.
I had a GI procedure, and they were worried that taking the 3 meds, which was atenolol, that really slows your heart down. It's a beta blocker. Atenolol, Norvasc, a calcium channel blocker, and lorastatin. And my pulse dropped down to 40 while they were doing a GI, and they were very worried. So I went to see the cardio guy, told him I was using the chin strap. He goes, and I go, Norvasc caused my feet to swell. Can I take off of it? He goes, sure. I go, I really don't like the unmotivated feeling of a beta blocker. Can I get off that? He goes, yeah. So with the CPAP in the chin strap,
which keeps
my health has increased. I know that.
Yeah, people don't really believe in it, Eric, but you're living proof that there'll be detrimental changes if you don't treat your sleep apnea. And once you do, that your overall health, you do feel better, don't you? Don't you feel more rested and able to attack?
Right. But, also there's other factors like this pandemic, which is just is really, affected our reality, is depressing for most people. Whereas they normally, would go to the gym in the past year, which I would have done. I didn't. I stayed at home.
We're going to see a whole new breed of people coming up that have put on weight during the pandemic that are going to be.
Oh yeah, everybody I know has put on weight. But one of the things I've always, as a habit since I was, in my 20s, watched TV and fell asleep. And I understand the blue light, affecting your sleep cycle. So I talked to a few technical people and they told me, try to dial down the color so you're in black and white so you won't have blue light hit you.
Right.
But I was told any light at all hits your pineal gland, and no light, you secrete melatonin, which helps you sleep.
Right.
I don't know if they've proven that the chemical you can buy is as good or not. I don't know.
Yeah, I'm not a big fan of, I have a friend of mine who uses it religiously with their child, and I'm just really worried about that because it's a hormone, but it's still a supplement, so it's not regulated by the FDA. Even though the FDA,
so they can give you crap.
Right, we don't really know what's in there. So I would stay away from those things, especially if you're on multiple medications. And you're a classic example, Eric, where you've had what we call refractory hypertension, where you tried 3 different medications and you still had high blood pressure. We know with patients like yourself that if we get them on a CPAP or a BiPAP, we change that outcome. And
I thought of oxygen because when I wasn't on CPAP, I was at a club and they had an oxygen machine, an oxygen bar, which is very popular in Japan. So I wasn't getting enough oxygen. I'm sure I wasn't on CPAP. And I breathed in the oxygen. And as I left the club about an hour later, the police really looked me up and down as if I was in some kind of drug induced or, or knocked out.
Yeah, I'm not really sure how they get away with that in this country. They tell you they pump oxygen to casinos. They can't do that because it's regulated by the FDA. So
what they do is, I looked into this after trying the machine in the club. It's illegal and you need a prescription for a bottle of oxygen. But they have a machine which makes oxygen. It costs $2,000 in those oxygen bars. And I'm sure they do use the same thing in casinos.
Well, they can, yeah, but those are still regulated by the FDA as well. I'm not sure what they do to get around.
But it doesn't, half the casinos are in Indian land. They can do whatever they want to do.
Yeah, probably.
But another thing, the blue light, I have like a streaming device to get a tiny LED blue light on it. Is one blue light like that enough to affect you?
Not really, but some people are very sensitive. My husband hated on the air conditioner, there's a little light on the plug that tells you it's plugged in. He had to put black tape over it. So everybody's different,
Yeah, that's another thing too.
That doesn't bother me, but he has sleep apnea as well. So he was more sensitive to the environment in our bedroom than I was, per se.
And I'm in Florida. It cost us a fortune for us to put our house under 60 degrees, like you were saying, your body likes.
Yeah, unfortunately, you're not. Yeah, you're in a place where it's warm most of the time.
So I'm used to 80, it's 90 degrees out right now.
Your body may have gotten adjusted to that, and you may fall asleep still in an environment that maybe I couldn't fall asleep in just because you've been living there for so long. So.
I do have a friend from up north that moved down here. He keeps his house at 68. I went to visit him and I was freezing. I was sleeping with my clothes on, a couple of blankets, but he's like, I don't want to grow mold. So that's why I keep it so cold. But, you know, I don't know anybody that could even afford to keep their house under 60 in Florida.
Well, you know, that's the ideal temperature, you know, to keep it low, but obviously that's not achieved by many people. A lot of people put their thermostats up to, especially up here in the Northeast, where, you know, in the winter, they're putting up to 70, 75. So everybody's different, but that's what the science shows, is that our body likes it cool when we sleep, and that's when it sleeps best.
Mm-hmm. See, you know, one of the things is getting your brain to shut down. I know a lot of people that say they try to go to sleep and then their mind just races constantly, and they have issues with that. An issue I developed from working that terrible work schedule was I get home at six o'clock in the, well, if I got work at night shift, I get home 3 o'clock at night, and I had to get up at 8 o'clock for my other job. So I didn't have that many hours. I had about 4 hours, like I said, and I eat from a McDonald's tray and go to sleep. You know, not McDonald's foods, not much better, but I eat and go to sleep. After eating and going to sleep over a period of time, they did an upper and lower GI because I had stomach problems. I had to take Tums Pepto every night. They said I had esophageal erosion because I ate, my stomach secreted acid. Then I laid down within 15 minutes and the acid went up to my throat. So I had to go about 3 months, no acidic orange juice, no caffeine, no tobacco, you know, no vanilla ice cream. I guess it's that sensitive to small amounts of alcohol, but it did heal. It's like I had to repair myself after what I did from working and overworking. And I had a white collar job. I was a pharmacist, but I was just, you know, I checked about 350 prescriptions an hour, which is, you know, just totally crazy, but it wasn't a retail atmosphere, you know, so it was closed atmosphere. So you could, with laser checks, go that fast, but, you know, going that fast, everything's racing and then slowing down would be difficult. So,
well, I'm glad to hear that you're a successful CPAP user, and I'm glad to see that you've revisited after so many years of not using it, and I'm glad that you're benefiting from it. Stay well, Eric, and thanks.
Yeah, actually, I've been very successful with it. All my doctors are very amazed.
Good, awesome.
Thanks for joining us, Eric.
Stay with it.
So the seminar is over?
Yeah, we have them once a month. Different topics.
I just caught it and went, oh my God, that's only 15 minutes from now. I can register and get on it.
Yeah.
No, we appreciate you joining us.
Okay. Thank you for your time.
Yeah, thank you.
No problem. Stay well, Eric. Have a nice holiday weekend.
You too.
Thank you.
Both of you.
All right, Laura. Well, another nice afternoon together.
Thank you. Thank you, everybody, for coming or listening, and hopefully it's beneficial and you get some traction out of this so that we can get some better night's sleep.
Yeah. So everybody can look for their invites for next month. We'll have another theme prepared that centers on sleep health, respiratory health. It all goes together, and we want everybody to join us again. And if they have any questions, they can always reach out, Laura at hpfy.com. You can call our main line, and they'll get in touch with Laura as well, 866-316-0162. And as always, available 24/7 on our website, healthproductsforyou.com or shopnebulizer.com. All right, Laura, thanks so much.
Thank you very much, Justin. You guys, everybody have a nice and safe holiday weekend.